Alright. So I'll be doing hip palpation, also called the coxifemoral joint, and we're gonna start the anterior side of the bones. So here we have the ilium, superior, that is the iliac crest. Then if we move medial, we'll have the anterior superior iliac spine, followed by the anterior inferior iliac spine. Then we have the medial to that is the lesser trochanter, and lateral to that is the greater trochanter of the femur, which is femur is here right here. And we have the intertrochanteric line of the femur, which is on the anterior side. And we also have the pubis, which is this region. And the iliac fossa is internally of the ilium, which is medial. Alright, turn around. So if we move medial from the iliac crest, we'll be on the posterior superior iliac spine, which is also called the back dimples for some people, or back dimples are present for some people. Then inferior to that is the sacrum, followed by the coccyx inferiorly. Then we have the intertrochanteric ridge, found between the greater trochanter and lesser trochanter of the femur on the posterior side. And the inferior to that is the pectineal line, followed by the gluteal line, and then inferiorly to that is the linea aspera of the femur. And between the greater trochanter and the gluteal line of the femur is where you can find the sciatic nerve. And I believe that's it for bones. So we'll move on to the bursas. I'm sorry, the ischium is located here, which is part of the pubis, and the ischial tuberosity is the point end of the ischium, also called the sitting bone. And there's also a bursa underneath on the attachment side of the ischium bursa. And then there's also the, I'm sorry, turn around. Yep. There's also the psoas bursa, which is in the pubic region. And then there's the trochanteric bursa, which is located on the greater trochanter. And those are sacs filled with fluid, which help lubricate the joints. Alright, so we'll move on to the muscles. So we'll start with the iliopsoas, which is two muscles, the psoas major, which originates on, turn around for me. Right, that's good. Which originates on all lumbar vertebrae processes from T12 down to all lumbar vertebrae. And that inserts into the intertrochanteric, the lesser trochanter of the femur, and that's responsible for hip flexion. Then we have the iliacus, which originates on the iliac crest, and inserts into originates in the iliac crest and inserts into the lesser trochanter of the femur, and that also does hip flexion. Then we have tensor fascia lata, which originates in the iliac crest, outer iliac crest, inserts to the greater trochanter, to iliotibial band, into the greater tubercle, and that's responsible for hip flexion, internal rotation, and abduction of the hip. Then we have the piriformis, which originates from the sacrum and inserts to the greater trochanter, and that is responsible for external rotation of the hip. Then we have the gluteus muscles. So first we saw the gluteus maximus, which is the largest one, that originates on the sacrum, coccyx, iliac crest, and the gluteal line of the ilium, and that inserts into the gluteal line of the femur and greater trochanter. I'm sorry, greater trochanter into iliotibial band. No, it's a greater trochanter. And that's responsible for hip extension and hip external rotation. And we have the gluteus medius, which originates on the anterior and posterior gluteal line of the ilium and iliac crest, and that inserts the great trochanter, and that's responsible for hip internal rotation and hip abduction. Then we have the gluteus minimus, and that originates on the superior inferior gluteal line of the ilium, and that inserts to the great trochanter, and that is the movement for that is hip abduction. Then we have the bicep femoris. There's a short head and long head. The short head originates on the linea aspera of the femur. The long head originates on the ischial tuberosity, and those insert into the head of the fibula and lateral tibial condyle. Those responsible for hip extension. We have the semimembranosus, which originates in the ischial tuberosity and inserts into the medial tibial condyle of the tibia, and that's responsible for hip extension. Semitendinosus, which originates on the ischial tuberosity and inserts into the pesian serine, which also does hip extension. And then we have the sartorius, which originates on the anterior superior iliac spine and inserts into the pesian serine. That does hip flexion, hip external rotation, and hip abduction. We have the bicep femoris, which originates in the anterior inferior iliac spine and inserts into the tibial tuberosity, and that's responsible for hip flexion. Then we have the gracilis, which originates from the pubic bone and inserts to the pesian serine. The movement for that is hip adduction. Then we have the pectineus, which originates on the pubic bone, inserts into the pectineal line, and that's also responsible for hip adduction. Then we have the adductor brevis, which originates on the pubic bone and inserts into the proximal 1/3 of the linea aspera of the femur, and that also does hip adduction. Then we have the adductor longus, which originates from the pubic bone and inserts into the middle 1/3 of the linea aspera of the femur, and that is also responsible for hip adduction. And last, we have the adductor magnus, which originates from the ischial tuberosity in pubic bone and inserts into the distal 1/3 of the linea aspera of the femur and the adductor tubercle, and that also does adduction of the hip.